Hi, my name's Tasha and I'm an intensive care nurse. I've been an intensive care nurse for the past 6 years, and I'm going to tell you a little bit more about my experience during COVID-19. In the beginning, I thought that it wasn't real. It wasn't going to happen. We had about 2 patients coming with COVID, and we still then thought it would be like swine flu patients, Ebola patients. I did a bank shift in a cardiology unit, and middle of that shift, they literally had to stop the clinic from running because of the fear of infection risk to other patients. So even then I thought, oh, that's quite odd. Hospitals never usually stop services like that. I then had a few days off and I went back into work. The unit was absolutely heaving. We normally look after 10 ventilated patients on the intensive care unit, and we also have another unit which is our high dependency unit, in that the patients are still very unwell but they don't require ventilation. In this case, a lot of the patients, nearly every single one of our patients, was gravely ill, and we'd never worked to that kind of capacity before. We'd never had to wear PPE for a 13-hour shift. We weren't used to not going outside, going downstairs, having lunch, not having to walk around halfway around a hospital because they had to try and work out a system in which we didn't infect other patients, particularly patients were having surgery, which then all came to a halt. We eventually had to take over other areas of the hospital to try and ventilate more patients. So we had to use the theatre recovery area, put more beds in there, use the ventilators from theatre, which none of us were familiar with. We hadn't had any training, and we just were literally thrown into the deep end and told that we had to get on with it. We didn't really have a choice. We had other ventilators brought in from other areas, and none of us had been trained. It was very uncomfortable working in that situation where you've gone from one day knowing exactly what you're doing, being competent, to knowing nothing at all. There's a very much of like a hierarchy in that you've got doctors, you've got nurses, you've got physios. Everyone has their own job role. We were all in the same boat. We all didn't know what was going on, how we would treat these patients. We'd never seen illnesses present like this before. It was just the blind leading the blind. In terms of like lifestyle for myself, the fact that you had to, on your days off, line up to go and buy basic things like food in Tesco's, and they were trying to do the best in that they were saying, okay, NHS staff can come on a certain day, but it meant that you had to get up at like 6 o'clock in the morning to line up to go and get basic items, which sounds absolutely crazy. And it felt crazy, like, what am I doing? To just get bread, milk and eggs, and being in a store for about 3 hours because everyone else seemed to work for the NHS as well, and they also needed to eat and drink. What was nice was that local companies and restaurants were making food and meals for the nurses and doctors that were working in the intensive care unit, so that we were getting proper meals to eat throughout the day, and possibly even to take home, because just on a normal shift, it's impossible to go there not having fed yourself, because you're utilising so much energy. Because we probably weren't eating and drinking the way we should have been, that obviously exacerbated our tiredness. It made the shift more stressful. It made it more emotional. We were seeing patients die without their relatives. We had to be their relatives. And even though that is part of a nursing job, we hadn't seen it on that level ever, because whilst we would hold someone's hand or comfort somebody, they always had a familiar face there with them that were allowed to come in and spend time with them. And if they were potentially dying, we'd give them all the time that they need. But because we were then we were then in a pandemic, and we also had to protect the general public. We had to become those patients' family, and that became extremely difficult because people were dying in droves. I think normally on average we would probably have about 2 to 3 deaths in an ICU a month, but those deaths are often expected. There was one particular day where about 5 people passed away in the space of about 10-15 minutes, a very, very short space of time. And it really, really disturbed a lot of us. We were having to take on everything. We were having to take on our job. We were having to take on being a relative to somebody else. In addition to that, we were having to train all the other staff that came to help us. We were then left in a position that we didn't even know what we're doing, let alone having to train other people that, yes, they do have some sort of medical qualification, but they weren't trained in intensive care. Those patients need to be constantly monitored. You're constantly drawing up drugs. You're constantly checking on the ventilator. And if you're not doing so, it puts the patient at risk. There was talks of we're running out of consumables, ventilator tubing. There was even a time where they were saying that we were going to have to wash out the ventilator tubing in order to ventilate more patients. And in terms of infection control, that should never happen. It completely, I can't even put it into words at how ludicrous it sounded, but it was kind of like they were saying we're having to work out the lesser of two evils. Like they either don't have a ventilator or they have essentially dirty ventilator tubing in order to make these people get through another day or even another hour. I find that quite disturbing. How it affected us, our mental health, was horrific. It was huge. And I found it personally very difficult to deal with just because of what I did sign up for compared to what I then had to go through and how I had to nurse. And I don't want to nurse like that. I know we're qualified and skilled people, but we're also human beings in that we had never experienced anything like this before. And all that kept happening, they just kept applying more and more and more pressure onto us. And it really took its toll in the end. I then saw a psychologist at work who then referred me to an NHS talking therapy service. I called them and they unfortunately weren't able to help me immediately and said I'd be put on a waiting list. They had no idea how long the waiting list would be, and they said, "Are you going to be okay?" At that point, I didn't know if I was going to be okay. I was pretty much coming home from work and crying my eyes out, and I felt like I was in a black hole every single day. I became increasingly anxious. I didn't want to go to work. There was a point where I think 3 or 4 weeks after the pandemic started, I'd gone on annual leave. I came back to work and I start shift at 7:30 in the morning, and by 7:45, I literally had a panic attack. It was so overwhelming and I just thought, I can't do this anymore. So I had to go off sick. Shortly after that, I then got to speak to someone in the talking services who then actually diagnosed me with post-traumatic stress syndrome, PTSD, in that because I was getting a lot of flashbacks. I literally would shut my eyes and I would see dead people. I wasn't able to go into the supermarkets because of all the people that were around us on the unit. There was a far greater staff and foot flow going through the intensive care. It just brought me back to that time, and it was I felt like I couldn't go anywhere. I felt like I wasn't safe anywhere. I felt like that if I was at work and we did get ill, I would then put my family at risk. My son at that point had to stay with my mum for about 9 weeks because we knew nothing about this virus. At the time, though, it didn't feel like we were putting ourselves in harm's way. We were just trying to get through a job. It was only when I came home and sat down and thought about it, I thought I might die. I might never see my son again. And that was very, very upsetting. I've since been having cognitive behavioural therapy, CBT, and they've given me a lot of coping mechanisms in order to go back and try and cope with the emotions that I'm feeling, how to cope at work, and it has helped, but I'm definitely not over it. I've since gone part-time at work because I don't want to be there as much. If I'm really honest, I don't actually want to be a nurse anymore. Pretty much not because I don't want to care for people, I do, but I don't feel like the government cares about us enough. It very much felt like a kick in the teeth that they then all got pay rises and then said that the nurses and doctors are not going to get pay rises after everybody clapped for us every Thursday saying how well we were doing. That was quite... I found that quite disturbing in that people kept saying that you're a hero, you're going out to help people. ICU nurses were then thrust into the limelight. I liken that to being a pupil at school and having to do a show and you'd get stage fright, but you're forced to try and get on with it. It was... No one knew who I was before. No one knew what really intensive care nurses really did. And that was very overwhelming, and it came with a lot of anxieties, and a lot of people all the time, like friends and family, were constantly asking us questions when really, me personally, all I wanted to do was run from it and escape from it. So if I could let someone know one thing to take away from this experience, I think I would say to look after your mental health. Recognise when you need help. Talk to people, because that's one thing I probably didn't do straight away, and I wish that I had, because I spent too many days feeling anxious. I spent too many days upset. I spent too many days feeling embarrassed that I couldn't do my job properly. I spent too many days blaming myself and allowing me to think that I put people's lives at risk when really it was actually the government that didn't help us and didn't support the NHS. I think if there are petitions out there and there are people or charities that will listen to you in regards to what's going on, please support them. Please support mental health. There's nothing worse than letting people go under on their own. Don't feel embarrassed. Don't feel ashamed. Sometimes situations are put in your way that you have no control of, e.g. this pandemic. We have no control over this. We didn't do this. We didn't create it. Don't believe everything you read or hear on the media. But my main point is please, please, please look after yourselves.